A little more, and lift up your chin. Okay, good. So now my eyeball is right at the occlusal plane, and I'm looking down there. And what I'm going to do with any diamond of my choice, as long as it's green, and I'm going to estimate the long axis of the crown. I'm not letting the contour of the tooth guide me. The long axis of the crown. And what I'm going to do, I'm just going to slice a dish off the buccal and off the lingual. I'm not going to wrap it around from embrasure to embrasure. I'm just going to take a slice. Okay, so I'm going to decide what is the primary plane I want, and I'm just going to see quickly like that. Take a slice off it. I'm not cutting a margin yet. You can come on over here. Okay, see that slice? Now I'm going to go to the lingual, and I'm going to, okay, that's the angle, but I'm going to straighten it up a little bit from that. I'm going to come to the lingual. I'm going to make a flat slice there. And I can see directly whether those are converging a little or not. Now I'm going to take a second evaluation of that. Are they really converging? I'll put a mirror up to the occlusal. I'll close one eye and I'll ask myself, can I just barely see both planes with one eye? And the answer is yes. Okay, now, okay, this is not a comfortable place to cut. Is this PFM or all metal? Okay, then I want a chamfer diamond. Now, using that guide, where's the 014 green? Okay.
Which chamfer are you using right now?
Chamfer diamond 014 green. Now I'm going to watch your toes. I'm going to come more to 9 or 10. I'll say, can you turn your head to look to my assistant, please? Chin down a bit. Okay, thank you. Now, I've got that plane to guide me. I'll lay the diamond on the plane and use it with a little help from this finger. I'm going to feel at what angle am I entirely in contact with that plane. Because I want to cut in the same plane. Now my fingers are going to memorize that position. Okay, so I'm going to stay in this position. Okay, and then we'll just, that plane guiding me, we'll start to cut that surface. Now after a while, I may have drifted. I may be gradually tilting. So briefly, I come back here, look towards me again. I'm just going to check it again and say, no, I'm still good. It looks like I'm cutting at about 10 degrees. So maybe I want to go in a little harder with the tip. Okay, so again, I'll feel for that. I'm in point contact, bodily contact. Fingers, do your job, memorize. And I'm going to emphasize a little more with the point. Now, I'm not going to take this all the way. Now, by direct vision, I'm checking up on my distal mesial tilting. Okay. All right. How do I manage the lingual? Lingual, I'm going to have to move to 11 o'clock or 12 o'clock. I'm going to ask the patient, turn way over to the right for me. That's good. Okay. Same process. Now, on a real patient, that mirror is going to be holding their tongue out of the way. Okay, because the tongue's always trying to play with your diamond. Get it into contact. Lean way over to check your mesiodistal tilt, or like I have at home, I have a two-sided mirror. So I'm retracting the tongue, but I can look in the mirror there. Okay, so get into full contact. Fingers do your job. Memorize the angle and start to do the cut. Now, I won't cut either surface more than 50% before, okay, and then I will stop and I'll check again. Is my taper going the wrong way? Okay, so that's how I do that, making the two slices to create what I call a cutting guide. Okay, and then once in a while going back, check, check, check again. Now, what if, oh, you guys aren't into bridge yet, okay.
How do you do the occlusal and the proximal as well?
Okay, on the occlusal, I do something that you're not taught to do because of the people I'm training for board exams. We have to be really, really super accurate, more than for real patients. So I have them cut two cut back putties. And that first putty after doing a rough cut on the occlusal, and you want to know, is it right, is it wrong, we slice the putty a millimeter at a time, and we destroy it gradually, okay? So I'll slice it first through the mesial fossa and say, okay, what corrections do I need to make in this area? Then I'll slice it halfway up the cusp slope. What corrections do we need to make here? So it takes more time, but it's super accurate, okay? So that's how now the other thing, before I do that, my rough cutting, so this is a 014, the tip will be about 0.8. I'll do some depth grooves, but now I'll do my depth groove just mesial to the cusp tip, because if I cut it in the cusp tip, I lose my height reference because the cusp tip is gone. Okay, so I'm going to put the full, okay, this has got to be 1.5, so I'm going to put the full diameter in that triangular ridge, just mesial to the cusp tip. Now you can either measure that, that's not yet barely a millimeter. You can either measure that with your putty on, or I can measure the triangular ridge. So I'm about 1 and 1.2 right now, okay? And I'm going to...
So did you just cut the triangular ridge?
Yeah.
Right on the ridge.
Just mesial to its highest point, because I don't want to lose my... See, I did the measuring, so if I had cut right in the middle of the cusp, then if I measured 1, it might be 1.2.
Okay.
You know what I mean by that?
Yeah.
Yes, I do.
Okay. So now I do what I call snow plowing. Using that thickness of the diamond, I'm just going to plow forward, keeping the diamond always a thickness into the tooth. You see, the remaining tooth structure tells me how deep I am. So I'll just snow plow forward there. Sorry about getting all the burn on the video. We need more water here somehow.
Yeah.
Yeah, we don't have a water wrench to adjust the water. So with a light touch, we get rid of some of that burn. Now at this point, we should be undercutting. Okay, then I'll do the same thing. I'll go in the middle now of the buckle groove. Try and do that intermittently to reduce the burn. And we'll come uphill to meet that other point we had created. Now, again, I'll work my way right through the whole tooth that way. Now, the mid-buckle cusp, just me. Now, notice I'm keeping the burr at a tilt to follow the average of the triangular ridge slope, but also that ridge turns into the tooth this way a little bit. So again, we'll follow that. Let's get the diamond totally into the thickness of that.
Immediately again to the right.
Yeah, we're going to go
Tip of the triangular ridge.
correct, and then we'll pull down into that buckle groove we made. Okay, then I'll go into the distal groove. Now, why do you see me doing this? Because on these Prosthodontic teeth, the contours are very convex, and I'm trying to do a uniform reduction. Now again, all this should be under reduced. And then near the distal marginal ridge, get the full diameter in there. Your distal cusp is going to disappear in the whole process anyway, or almost entirely disappear. So don't be too anxious about it. All right. Now I'm going to come to the 8 o'clock position again, because I'm going to switch over to the other side. Do the same thing from the lingual. I need a longer grip because I'm going to finger rest on the anteriors. I'll do the same process. Throw a little light in there with my mirror. Just mesial to the triangular ridge of the mesiolingual cusp. Get the full diameter of the diamond in. Oh, I have to be more careful. This is all gold now. We don't want the whole diameter. Okay, you tell me, what do you remember about the parameters? How much reduction for gold on a non-functional cusp? 1. Okay. That would be an ideal number. The range is 0.5 to 1, depending on the textbook that you read. And I think what you folks are using Schillenberg. Now don't stay and play too much, because without a guide, after you've reduced the tooth, let's say an X amount, now you've lost your starting point. So once a tooth is reduced, unless you've got a putty cutback guide, stop playing, because you don't know where you're going. Once it's gone, you don't know how much was removed. All right, now, earlier we did not complete our axial reductions yet. Just to quickly get into talking about this, I do my functional cusp bevel last, because I want the putty to guide me. Because when I did my primary planes, okay, Schillenberg teaches you to do the functional cusp bevel arbitrarily with depth grooves. Not totally arbitrarily, but using reference points. But during the creation of your primary planes, you might have tilted a bit to the lingual. You might have tilted a bit to the buccal. And if you tilted lingual, you're going to have less functional cusp bevel. And if you tilted buccal, you're going to have more, but you won't know that unless you got the putty to show you. Okay, the putty will show you where and how much. Now, so as I was saying, if I'm cutting a crown, okay, I'm going to go proximally first. I'm going to slice through the proximal. Then I'm going to use the putty I'm going to destroy to assess my occlusal. And so first I'll take a slice through the mesial fossa, and I might find, oh, the lingual's under reduced. So then I will touch up that lingual part of the fossa a little more. When I'm happy with that, I'll take a slice of the cusp tips, and I find, oh, my buccal triangular ridge is not reduced enough. So I'll do so. So I work my way through the whole tooth, and I get an extremely accurate reduction. Okay, with a single section putty or even a 2-section putty, you really don't know. You really don't know. All right. So that's how you want to see quickly how to slice through. I'll go through the distal since it's the more difficult of the two. Let's think of two scenarios. Okay, number one, you've got a patient whose mouth is fairly accessible where you can sort of stretch the cheek over and get in there. But if you don't have that ability and the patient has a small mouth, or you're at the distal of the 7, you're going to have to go indirect. You're going to need to get your mirror between that constantly mobile tongue and the tooth. And for indirect, you always want to move the patient a little more indirect to lift up your elbows to clear the patient's chest and head. Okay, then in the mirror, check your positioning of your diamond, and we're going to go through there a little at a time. Now, a little trick I use when I don't just pull through that way. I slice as if I'm sawing. Now, that means most of my force is this way, not this way. If most of your force is this way, you're more likely to get pushed into the next door neighbor. By going a little bit at a time that way, I feel I have more control. And so I'm being subjective. I have no evidence basis for that, only my experience. I hope, oh good, the handpiece gives me some light. So I'll work my way through. I'm going to try to leave a paper-thin bit of tooth standing by notice I'm tilting my handpiece this way, okay? So the tip is outside between the teeth, but the body is farther in. All right, let's have a look again here. And all I'm trying to do is just go straight through from lingual to buccal. Notice I have a very long grip on the handpiece, meaning my finger rest is way over at the anteriors. Now I'm going to stop for a sec so you can have a look at the little bit that I'm leaving standing. Let me rinse and dry that a bit. Now what you constantly have to be careful of, and you already know that because you've done lots of these, that you don't pull it into the tooth or push it to the neighbor. So that's again why I'm doing these little increments. I'm constantly monitoring, am I going in the right direction? Anytime you feel confused, lost, stop and reposition, recheck. Make the movement without stepping on the pedal. Practice, rehearse the movement. right, so again, elbows up to clear the patient. Get the fog off. All right, get the light going. Now, if I had the room and the opportunity, I would put a matrix band around the adjacent tooth, but you don't always have the room.
Did I see the tilt of your bird, like in terms of how it tilts buccolingually?
Okay, let me lock it in. Buccolingually or mesiodistally?
Well, I mean,
Buccolingually, I try and keep it
mesiodistally.
straight. Okay. Do you have the big round mirror? Anyone have a big round mirror handy? Because then Jason can get a snap of that with the big mirror. No? Okay. Well, if you can get your camera over there, give it to Tiffany maybe. Maybe she can get a... Here, Will.
It's the glare of the light. Oh, there.
Oh yeah, okay, I see it. You guys
Okay? Are we good?
Yep.
Can I go back to work?
Yep. Sure.
All right, where's my tip? Now remember, this was for the patient whose mouth you can't stretch open wide, and you're stuck with having to go indirect. Now, I'm going to stop for a moment, and the reason is there's so much sludge building up there now that I can't see, so I'm going to stop. Rinse it out, get my visibility back. If you were running more water through the handpiece, you might not have to stop quite as frequently. Well, here, okay, if it was a 7 over here, I'm going to go indirect from the buccal. The problem is here, I can't.
So
You know,
if you could have, you would go for the
you know, if they had a piercing here, maybe I could hang it on their earring, but I mean, some people have a very small orbicularis oris. It's the only anatomy I remember, so I like to use it once in a while. You know, and I mean, I've had, you know, totally aside here, if you don't mind me telling the story. I had a patient once who came to me that needed a DO amalgam on tooth number 4 or 5. Said, open wide. I could not get 2 fingers between her teeth. She had, I forget what the term for it is. You guys are up on your anatomy. I've forgotten all of mine. She had a calcified stylohyoid ligament that stopped her jaw from opening. Okay? It's more common in Asian. Okay? She was a pastor's wife from a local church, and I had to fix his tooth. And so you can't come in from the occlusal. You come in from the lingual, and you destroy a lot more tooth structure in the process. Convenience form is your direction of approach. But that's, and then 2 years ago I had a dental assistant with the same thing. Open wide. How do you get your food in there? Well, all right. So you run into all kinds of interesting situations in practice. Now, it was so rare, I wouldn't have been able to make the diagnosis, but the patient already knew and was able to tell me what the problem was, so I didn't have to get out my textbooks and figure it out. Now, when you get to the very end, there's this tendency to, as you slip through at the last moment, you get pushed into the tooth. So when you feel yourself coming to the end, you grip it a little tighter, you go a little gentler, and follow through like a baseball bat hitting a ball. Push through just a little farther.
So what depth do we want to go in a practice? I feel like that's
Well, okay, right
Are we
now,
going in the head of the
because
bird?
it's at an angle, where you're at the top, you're going more than you think you want initially, but the bottom is a knife edge. Now we're going to go to the 014, no, 012. I will not use an 014 here. And now I'm going to stand it up straight, but at the very, may I draw a picture for a second? So easier to explain with a picture. Make it a premolar. Okay, so here's the filling. So my first cut with the diamond That should be a little lower, ideally a little lower. With the needle. Went in like that. I tried to leave a paper thin piece here, okay? And I want it to come out here. So what I have now, I have a badly angled cut with a bad margin. But now now I'm going to stand my normal chamfer diamond up a little straighter, but I'm not going to touch up here. What I'm going to do, I'm going to progressively do that, okay? So the first cut was to give me access. And since this is quite wide here, we have lots of room between the teeth, okay? Now another thing I do again that's different, I won't start at the bottom and push through again. I want to get the least amount of resistance. So I will always work my way down from the top. Nibble a little, nibble. The other thing that does when I first start, I've got all that room between the teeth. Okay, there's my diamond, I got all that space. And I'll nibble my way down. And what my eye is mostly paying attention to is that space. I'm going to try and keep that about a tenth of a millimeter between the diamond and the tooth. Okay, so I'll nibble my way down until now I've got that shape without having disturbed that any further. Okay. All right, now let's go and do it direct, since you can do it direct on this tooth. But again, otherwise I would do it indirect. So now I want to keep my diamond straight up and down. I'm going to start at that top end. I think, wow, I'm really lucky. I've got lots of clearance. So I'll just start to pass through. Right now I'm not touching much except at the buckle. Just swinging through. I'm not trying to, okay, right now, as I'm going down, I'm not trying to touch my tooth yet. I'm just saying, how close can I get to the tooth next door until finally I touch something at the tip. Okay, I don't need to come into contact right away. Except at the buckle here. Now I'm really concentrating on keeping that up. Everyone will have a tendency to go like that, to kind of sneak in between the teeth. Okay, now I want to see with the mirror, how close am I to the gingival papilla? Am I a ½ millimeter above the margin? Okay, we can drop that buckle margin a little more. And in fact, right now we have a margin that is not yet acceptable in width. It's skinny. And we haven't touched the next door neighbor. Okay, now normally I wouldn't do that until my primary planes are totally cut. Okay, I'll cut my primary planes first into the interproximal, because then I have less proximal work to do. Okay, because I hate the proximal. And what is the corner we all hate the most? Well, distal, correct. Distalingual when it's on the arch next to you. It's distal buccal if it's the side away from you. Okay? Yeah. And that feeling never changes even after 25 years. Okay.